So, hi friends, good evening to all of you. I'm Dr. Anshul Bansal, again joining you on this Unacademy platform. In today's special class, we'll study about the remaining parts of our must-know images section, that is the part 2. Here, we'll cover the things that we have left in the last part. Okay, so it will be a rapid revision of the entire orthopedics in form of images, very important images, and all these images are very useful for your coming INICT and the FMG examination, that is in the November and the December respectively. So we'll study about this, and currently I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020. Okay, so let's start today's session. And before starting, I would just briefly guide you about our various subscription plans that are available on an academy for the NEET PG. And the first one is your Plus subscription. The Plus subscribers will get access to all our live as well as recorded classes, the entire QBank they can access, and also they can compete in live tests and quizzes, all of which is formed by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to log into multiple devices with the same account, so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with the printed notes. While subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one is your iconic subscription. The iconic subscription is the best, and what makes this best is that apart from the things that I have told you earlier, in extra me you will get the prep ladder and all of the prep ladder, including its all entire QBank, the video lectures, the rapid revision courses, the grand test, etc. Everything you will get. And on an academy extra me you will get the live structured well structured live batch wise classes. And we have structured our batches and formulated a course in such a way so as to build the basic concept about any topic or subject first, then going into its in depth. And also after every test that you give, the iconic subscribers will get an individual test assessment sheet, so that they can analyze themselves, yes, this topic or this subject needs more revision, and what are the things that are asked more frequently, what are the types of questions, and what are the things that I am missing. So they can plan their preparation according to it, which is very necessary. And all this is available in an iconic subscription. While subscribing, you can use my code, that is Anshul B10, to get extra 10% off. Special classes are very special. I always emphasize and tell you to please attend this special class, because they'll give you extra edge over your competitors. And they are a very good classes, because they'll give you live classroom like feel, where you can interact with your educators in the live classes. You can just participate in polls and clear your doubts there and there only. You can watch it anywhere anytime on a mobile application, and also you will get the digital notes of every special class that you will attend. A QBank is very effective. Not only it contains 25,000 plus questions, but the main beauty of a QBank is that it have everything that is necessary for cracking any competitive examination. Entire theory, the recent advances, the recall questions, high yield MCQs, previous years MCQs, the image based, X-ray, CT, MRI based, instrument based, clinical scenarios. Every type of question is included in a QBank. Okay, so you should solve a QBank, and while subscribing for this QBank, you can use my code, that is Anshul B10, to get extra 10% off. Okay, now for the INICT as well as the FMG, we INICT के लिए 24th October को we had organized a grand test. Similarly for the FMG, on 31st of the October between 10 a.m. to 1 p.m. we are organizing a free grand test for the for the FMG aspirants scheduled in December. So please do give this grand test, and think it like this way, that 3 hours of giving the test and 3 hours of reading the explanation or solving the question, you will revise the top most important 300 topics for the FMG examination, which is a very high yielding thing, and you should give the grand test as much as possible. Okay, and targeting the NEET PG 2022 batch, as well as a newer batch called as clinical case scenario and instruments batch. We have started from 20th October only, so you can subscribe for any of these courses. And also we have launched a special feature called raise a hand feature, and it is launched to make a live classes more interactive and to increase the two-way communication of the learners and the educators. Okay, so please do use this feature. You just need to you tap on a button and you can digitally raise a hand so that the educator will know about your query. uh, I guess there's some issue with the loading thing here. I don't know what's the issue. Yes, it's not loading. Wait, let me check. The internet is fine. Okay, now let's start. So सबसे पहले this is the first image that we'll discuss. So the question for this is, you can type your answers. I'll give you like 5 to 10 seconds. Okay, so which benign tumor, I'm giving you a hint, which benign tumor of bone is this? Okay. Yes, the correct answer is osteoma. It is a benign tumor with no malignant potential. Okay, and even, this is a tumor which even does not require the excision, etc. You can leave it as such. Only cosmetic problems hogi, and most commonly it is seen on the facial and the skull bones in the young adolescent age group. Okay, in the young adolescent एज ग्रुप ओके बस इतना ही याद रखना है मेनली इमेज ओके नाउ व्हिच इट इज अगेन अ बिनाइन ट्यूमर व्हिच बिनाइन ट्यूमर इज दिस Yes, the correct answer is osteoid osteoma. Okay, the correct answer is osteoid osteoma. Why? Because see, there are two tumors जिनमें ये same picture होती है, that is the osteoblastoma and the osteoid osteoma, जिसमें there will be a sclerotic area. Here you can see in the CT as well as in the X-ray अगर ढंग से देखें. So this is a sclerosed area here with a central nidus. Okay, with a central nidus. So अब दोनों में differentiation कैसे करेंगे? So दोनों में differentiation जो होता है, it is based on the size of nidus. Based on the size of nidus, osteoid osteoma में, if the size of the nidus is less than 20 mm or is less than 2 centimeter, and in osteoblastoma, the size of the needles will be more than 2 centimeter. Remember this. Now osteoid osteoma की बात करें तो this osteoid osteoma is common in the bones of the lower limb, and it is mostly metaphyseal in location and origin. Okay, and it has no malignant potential, but remember ki here you have to do the excision, you cannot leave it as such. So this is osteoid osteoma. Now very commonly asked question, this is osteoclastoma, also called as GCT, that is giant cell tumor. And remember, osteoclastoma is a misnomer because it is not the tumor, or the main cells that are affected are not the osteoclast, but the histopathological image of this tumor have giant cells. That's why it was wrongly named as osteoclastoma. And इसमें जो important चीज याद रखनी है, that the age of presentation, या it will be presented only after the fusion of epiphysis. Okay, epiphyseal fusion के बाद ही you will see this. Yeah, it is in this age group. Now metaphyseal और epiphyseal इसमें कंफ्यूजन होता है. तो आपसे अगर कोई क्वेश्चन में पूछे कि which is the most common location of GCT, then remember, go for metaphysis. Okay, you have to go for the metaphysis. Metaphysis epiphysis दोनों में ऑप्शन है, तो metaphysis के लिए you should go. Okay, this is the location of the GCT. Benign tumor है, but it has a important thing, that is recurrence. Okay, recurrence is a problem with GCT that makes this treatment, the management of GCT very important. So you have to do the excision. So the treatment of choice जो होता है, it depends upon location of the tumor. Okay, suppose if the tumor is in fibula, that is proximal fibula or the distal ulna, then these bones are not functional as such. Okay, functionality में they will not hamper even if excised. So the treatment is excision only. But in all other areas you have to do the excision with turnoarthroplasty or any arthroplasty. Okay, remember this thing about the GCT. ये दो areas ऐसे हैं जहाँ पे only excision can be done. Okay, and one thing that you have to remember is, third is curettage and bone cementing. So you can curate or remove the entire lesion and then put the bone cement. So bone cement के two functions है. First of all, support, जो वहाँ पे lacuna create हो गया, pathological fracture and all, bone को support करेगा. But the very important effect is its heating effect, because this will generate heat and they will destroy the residual tumor cells. So it is very, very important, GCT. Most common location of GCT is your proximal tibia followed by the distal femur. Okay, proximal tibia followed by the distal femur. Okay, now if you see the histopathological imaging, very important, spindle to mononuclear cells with multinucleate giant cells which look like osteocytes. Okay, so very, very important, इसका जरूर से ध्यान रखना है. And very rarely they can even form the malignant GCT. Okay, and remember, malignant GCT जो होगा उसमें the most common location will be the epiphysis, because the metaphysis and epiphysis both, because the tumor will migrate. But remember कुछ important चीज, first of all, it is always eccentric in location, not the centric part, and also it will never break the cortex. It will never break the cortex. Okay, this is your GCT. Now, treatment of GCT we have already discussed. Now, which tumor is this? And this is a malignant bone tumor. So, which is this? Which malignant bone tumor is this? The correct answer is your osteosarcoma. Okay, don't get confused with osteoblastoma. इतनी ज़्यादा periosteal reaction is only seen in case of osteosarcoma. If you see this much of periosteal reaction, then ज़्यादा दिमाग नहीं लगाना, just go for osteosarcoma. Okay, so osteosarcoma is of two types. First is your primary, which is the most common type, and जिसकी picture we have seen. So primary में the age group is your young adolescent, and here there is no precursor bony lesion that is present. But in secondary, it occurs in elderly population, and there is pre-existing bony lesion or some pre-existing bony disease present. This is your secondary osteosarcoma. Okay, now most common location of this primary osteosarcoma या किसी भी osteosarcoma का, if you ask, it is your distal femur followed by proximal tibia. Okay, and it has a typical X-ray thing that you have to remember. Okay, it is very, very important. And the X-ray is, first of all, intense periosteal reaction, which is called as the sun ray appearance. Okay, intense periosteal reaction which will have the sun ray appearance. Okay, remember this is very, very important. Intense periosteal reaction with sun ray reaction. इसके अलावा Codman's triangle and all, ये सब तो you can see in other periosteal reaction also. Very important, ये हमेशा ध्यान रखना. इतनी ज़्यादा intense reaction होके it will be only be osteosarcoma, and the treatment of choice, it generally depends on the size and the nature of the tumor. But the treatment of choice अभी भी आपसे कोई पूछे, then it is amputation. But in option में, if you have an option, but it depends on the grade and the degree of the osteosarcoma, you can go for the limb saving surgery. Okay, so this is your treatment of choice. So here you can see in histopathological slides, you have the morphologically polymorphism. Okay, you will have pleomorphism and polymorphism with osteoid in between and necrosis and hemorrhage in between, and it can be lytic pattern, sclerotic pattern, or the mixed pattern. तीनों ही pattern में intense periosteal reaction will be there. In cut section, if you see, it will be gritty on cutting. Okay, grayish white with patches of necrosis and hemorrhages. And here you can see that this is a typical osteosarcoma, and okay, it will be the typical osteosarcoma, and the location is metaphyseal or diphyseal, which most common location of this is metaphyseal. Remember, not diphyseal. Osteosarcoma metaphyseal. ऐसे याद रखना कि O से जो भी start होता है, they will be metaphyseal. Okay, O से start होने वाले metaphyseal, except that osteoma जो facial bones पे होता है, otherwise all will be metaphyseal. Okay, this is osteosarcoma. Now, which is this? This is the histopathological slides. Okay, and these are called as pseudo rosettes. Okay, here you can see pseudo rosettes. So which tumor is this? This is your Ewing sarcoma. D के बाद E आता है. So remember that it will be diphyseal if long bones are affected, But remember, most common site is the pelvis. Most common site is the pelvis. It occurs in young adolescent age group, malignant, highly malignant. But the most common most common malignant bone tumor is your metastasis. Most common primary malignant tumor of the bone is your osteosarcoma, not Ewing sarcoma. Remember this. Okay, ये होता है. इसके अलावा the histopathological में the difference is there you will have pseudo rosettes here. वहाँ पे pleomorphic polymorphic cells थे, यहाँ पे similar shape के cells होते हैं which resembles like lymphocytes with a area of necrosis in between. And agar grossly you will see, so firstly it will be more irregular and more progressive as compared to osteosarcoma with surface पे you can very easily see the superficial vessels etc. Okay, that will be osteosarcoma. And another important thing is its X-ray appearance. So यहाँ पे जो periosteal reaction होती है in osteosarcoma, the periosteal reaction was very intense and irregular, but here the periosteal reaction is regular and which is called as onion peel appearance. Okay, एक के ऊपर एक regular, not that intense like in the osteosarcoma. And long bones, diaphyseal, and most common location is your lower limb bones only. And very important thing is that it is highly sensitive to radiation. So radiotherapy is the treatment of choice here. Okay, highly radiosensitive tumor hota hai ye. Okay, now what is this? This is a wait. This is a pelvic external fixator, and this is hemlock sling, both of which are used for the pelvic injuries, that to the open book fracture. Okay, open book fracture like this. Okay, so pelvic injuries mein you have classification which is called as the Marvin tile classification, stable and unstable में होता है. Okay, so open book में you will have the hemlock and the external fixator. Remember this. Now this is the blood supply of the femur head, and here there are three important arteries which are supplying the blood supply. First, second, and the third. The first one, this is your medial circumflex femoral artery, and this is your artery to the ligamentum teres, also called as the foveolar artery. Okay, it is also called as foveolar artery. So इसमें आपको सिर्फ इतना ही याद रखना है for any type of competitive examinations that medial circumflex and lateral circumflex are the two main branches with retinacular, and यही arteries are damaged in case of fracture neck of femur. Ligamentum teres artery or the foveolar artery is there, not damaged. Okay, but it cannot supply the entire head. That's why the femur head goes into the avascular necrosis. Okay, remember this. Now very easy, बहुत बार पूछा हुआ question है कि this is posterior dislocation of left hip, and the attitude here will be your flexion, adduction and internal rotation. Okay, most common cause is your trauma, if AP direction में trauma होगा. Okay, and most common nerve that is injured is your sciatic nerve, which will cause the foot drop. And the treatment of choice in any case of in any case of subluxation or dislocation is your closed reduction followed by maintenance of that reduction either in the cast etc or the traction. Here you will use the traction. Okay, so this is your posterior dislocation of hip. Most common hip dislocation is your posterior dislocation. Now anterior hip dislocation may the attitude will be obviously abduction and external rotation with knee in flexion, and the head will be in front or below the acetabulum, and uh, treatment will be the same. Okay, so जो closed maneuvers we can use, they also have name. It can be Bigelow's, just remember the name, इससे ज़्यादा deep में you don't need to go. Bigelow's maneuver and Watson and Jones maneuver. Okay, so traction, there are basically two types of traction. This is your skin traction. Okay, remember the image. This is your skin traction and this is your skeletal traction. Okay, in skeletal traction you can see that we have put two pins, one pin piercing both the cortex in the proximal tibia or the distal tibia etc. Okay, so this pin that we use here, okay, this pin that we use here is called as ST pin or the Steinmann pin. Okay, ST pin or the Steinmann pin. Just remember the images. Now we'll come to very important topic, that is fracture neck of femur. Okay, so fracture neck of femur and fracture IT femur में differentiation is very important. So सबसे पहले fracture neck of femur is intracapsular, यानी it is inside the capsule of the hip joint. So if it is inside the capsule of the hip joint, obviously the displacement will be less. The displacement will be more in IT femur. There will be less signs and symptoms. Here the signs and symptoms like pain, dislocation, deformity will be more, and both occur in the elderly population, remember. And the basic difference is that these never unite. Neck of femur never unite. That's why treatment of choice is always surgery in all age groups. Okay, and very high chances of avascular necrosis of the femur head, whereas the IT femur जो होता है, it always unite. Okay, IT femur, it always unites. So treatment of choice of fracture neck of femur is in young age group, you go for the CC screw, that is the corticocancellous screw or the dynamic hip screw. And in elderly population, even in the adults, elderly population में more than 55 years of the age में ही you go for the hemiarthroplasty, and उसमें भी the choice is bipolar hemiarthroplasty. Now IT femur. IT femur most commonly adults में ही होता है, elderly age group में होता है after 60s. So IT femur जो है उसमें if you are asked treatment of choice and if it is reduced or unreduced, you should go for the surgery. Answer, remember, reduced हो या unreduced हो, hip IT femur fracture है, nowadays you go for the surgery. So treatment of choice is surgery, and that too the proximal femur nailing, PFN nail is your answer. Okay, remember this. Okay, very important about the IT femur. Here at any age you will not go for the hemiarthroplasty because the neck and the head can be saved. That's why you will not go for hemiarthroplasty. Okay, now neck of femur में importantly you have to remember three classifications. Okay, the first one is your anatomical classification as seen in the images based on the fracture line. It can be 1, 2 or 3. The first one just below the head will be a subcapital, then transcervical, then the basicervical neck of femur. And remember, the subcapital have the worst prognosis. Okay, This type of neck of femur have the worst prognosis. The second is your Powell's classification. Okay, this is your Powell's classification based on the Powell's angle. If you draw two lines, first line will be horizontal to the superior surface of the head with the fracture line. Then you have type 1, 2 and 3. This is your Powell's classification based on the Powell's angle. And the next is your Gardner's classification. This is your Gardner's classification, and very importantly, it is based on rotational displacement. Remember, it is based on rotational displacement. This is your first type. Okay, Gardner's classification, it is based on rotational displacement, and first type is called as your impacted type, where the fracture will be incomplete, yani both the cortex will not be broken, incomplete, and obviously it will be undisplaced. So अगर कभी ऐसा क्वेश्चन आ जाए कि which is the type of neck of femur fracture which can be managed conservatively, then the answer will be your Gardner type 1. Whereas 2, 3 and 4 all are complete. In 2 you will have, here you can see, in 2 you will have the complete but undisplaced fracture. In 3 you will have complete and displaced fracture. In 4 complete, and here you can see the head will lose its contact, more than 2/3 contact with the remaining femur. That's why it will be type 4. Okay, this is your Gardner's classification. Now, which is image 1, and this instrument here, this is what you need to identify. This is image 2. So what is 1 and 2, you can write in your comment section. Okay, image 1 is your, it is called as your traction table or fracture table. Okay, this is यहाँ पे, see, this is your fractured limb. Even in case of femur or IT femur, shaft of femur fracture, where you need to give sustained traction, here this limb you can give the traction by rotating this one, and then you can operate very easily. So this is your traction table. And second one, this is your C-arm machine or the image intensifier TV, called as the IITV. This has completely changed the orthopedics, because now you can do lots and lots of surgery in a closed manner by seeing कि yes, मेरा screw या मेरा wire सही जगह bone में जा रहा है या नहीं जा रहा है. You can just see it under the IITV and do without opening the entire bone or the field. So this has changed orthopedics, that too in a good way. But for the health workers, it is not that good, because myself including, we take plenty of shots in a single OT, and radiation बहुत बड़ा factor होता है. Like in a continuous 6 to 7 hours OT, average every day we have around 40 to 50 shots. And although we wear lead apron and all, but yes, risk is there. So yes, for the health workers it's not that beneficial in the long term, but for the patients बहुत अच्छी चीज है. Okay, now what is this? This is a type of sling which was previously used for managing fracture IT femur conservatively. Nowadays obviously it is not used, and also for the distal femur it was used. So it is your Hamilton Russell traction. Okay, this is your Hamilton Russell traction. Just remember the name. Okay, now neck shaft angle of the femur is very important. Normally अपन adults की बात कर रहे हैं, not children. In adults Normally the neck shaft angle is between 120 to 140 degrees, remember. Okay, this is your shaft, this is your neck. But if that neck shaft angle is less than 120 degrees, it is called as coxa vara, and अगर ज़्यादा हो जाता है then it is called as coxa valga. Very important, you need to remember this. Whereas in newborn child, normal angle is 160 degree. Okay, normal neck shaft angle is 160 degree. Okay, remember this, this is also very important. Okay, now what is this? This is your gallows traction, also called as Bryant's traction. Now my question is, in which fracture it is used and in which age group? Okay, two questions. फ्रैक्चर किस में यूज होता है एंड उस फ्रैक्चर पे भी किस एज ग्रुप के पेशेंट्स में यूज होगा? Okay, so the fracture in which it is used is fracture shaft of femur in less than 2 years of the age. And remember, first of all, 18 kgs of the weight से ज़्यादा नहीं करना है, and the hips should not touch the bed or the ground, and skin traction is applied. So obviously it is cumbersome, not patient friendly. That's why it is not used nowadays. It was used previously. Okay, now these are fracture patella, and these are different types of patella fractures. Okay, so the treatment of choice in case of patella fracture is, if you'll go with undisplaced two-part fracture, then you can manage it conservatively, and you have a special cast or slab which is called as the cylindrical cast, because it is not till the head of the metatarsals, it is only till the distal tibia. Okay, ankle joint is not covered. Okay, but if it is displaced two-part fracture or more than two-part fracture, like here you can see multi-fragmented, undisplaced or multi-fragmented, okay, then you have to go for the tension band wiring, that is K-wire TBW you need to do. Okay, so there are three major bones where you use the tension band wiring. First is your patella, second is your olecranon fracture, and third is your medial malleoli fracture. Okay, in three places you use as a treatment of choice tension band wiring. Okay, this was about patella. Okay, now for patella, you for visualizing the patella correctly, you need to have a alag view which is called a skyline view, like this. Okay, and there you can easily see the patella. Okay, now this is fracture. These are fractures of tibia, and tibia में भी किसका, tibial spine or the plateau of the tibia, and इसके लिए you have one classification. Name the classification that is used here. Just आपको एक ही चीज याद रखनी है, that is classification. Name of the classification, and it is called as Skadsgård classification. Okay, it is called as Skadsgård classification, very important. And as a rule of law, आप हमेशा याद रख लो, if any fracture, if it is intra-articular, that is the fracture line is running inside the joint, then the treatment of choice is automatically surgery, and not that to plating, not nailing. Okay, that is ORIF with plating is will be the treatment of choice. And in case of children and intra-articular, you can go for just K-wire fixation. Okay, you can just go for K-wire fixation. Yes, in all type, even in adult supracondylar humerus, the proximal tibia, the distal femur, the distal tibia, the distal radius, every bone whose fracture line is running intra-articularly. In case of adult, the treatment of choice will be ORIF plating, but that fracture should be closed. Okay, not open. Fracture should be closed without any lacerated wound or compound injury. Okay, remember this. Now patella ke saath you need to remember one important ratio which is called as the insult Salvati ratio, and this is the ratio between the length of the patellar tendon by patellar height, and normally it is 1. Okay, normally it is 1, but if it is more than 1, that is called as the patella alta, where the patella is dislocated towards the femur, and if it is dislocated towards the tibia, it is called as patella baja. Okay, and remember, recurrent patellar dislocation may you have patella alta. Okay, patella alta, remember this. This is very important, and this ratio is used to determine the height of the patella. Now patella ke bursas are very important. Okay, and you have two important signs or two important disease name wali. So this is your housemaid's knee. I'm telling you कि इसको बोलेंगे housemaid's knee, but my question will be, which bursa will be inflamed? Okay, which bursa will be inflamed? So this is your pre-patellar bursitis. Here you will have the pre-patellar bursitis, that is in front of the patella. एक होगा ऊपर, that is suprapatellar bursa, and एक होगा नीचे, this is your infrapatellar bursa. And this infrapatellar bursa का जो bursitis होगा, it is called as the clergyman's knee, and it is very simple. एक बार housemates की तरफ like they sweep the floor, then obviously the pressure will be more on the pre-patellar, and like the clergyman in the church and all during worshipping, the pressure will be just below the patella, that is infrapatellar bursa. That's why infrapatellar bursitis will be your clergyman's knee. Now this unhappy triad, very important. First of all, we'll read about the unhappy triad or the terrible triad of elbow. Okay, and isme what you have, first of all, dislocation of elbow. Okay, dislocation of elbow with fracture radius head and which fracture conoid. Okay, now unhappy triad, यहाँ पे आपको ये चीज याद रखनी है that medial collateral ligament and medial menisci, they both are attached to each other, and ये दोनों जो होते हैं ये हमेशा क्या होंगे, साथ में होते हैं. तो एक की इंजरी के साथ दूसरी इंजरी फ्री में आती है. सो अगर इन दोनों के साथ ACL भी इंजर्ड हो जाए, all three they form the unhappy triad of the knee, and it is also called as the O'Donoghue triad. Okay, generally seen in violent sports like rugby players or football players, etc. This is your O'Donoghue triad, and treatment of choice is obviously surgery. Okay, now various tests which are important. Okay, so we'll see the images. First of all, let me give you a hint. This is a test to check ACL injury. Okay, so now what is the name of this test? Okay, so this is your Lachman test used for the ACL injury. Okay, so very easy to test. ACL का क्या काम होता है? ACL prevents the anterior dislocation of the tibia. Okay, so if ACL is injured, the anterior direction में movement of the tibia जो होगा, it will be very easy. Okay, so here कुछ भी नहीं कर रहा था. From one hand, fix the distal femur, proximal tibia, and in slide fraction, you just pull the proximal tibia upwards. अगर easily pull हो रहा है anteriorly displaced, then it is positive, means there are high chances of ACL injury. ऐसे ही similarly, you have the anterior draw test for the ACL and the posterior draw test for the PCL, where you posterior cruciate ligament PCL के लिए, where you can see that posteriorly the tibia can be sagged. Okay, now this is your knee brace, which is used to support the knee, especially in case of ligament knee injury. Okay, ligament knee injury. And हमेशा remember, medial menisci and ACL, they are managed operatively, whereas other ligaments can be managed non-operatively or conservatively by immobilization, but medial malleoli and ACL के लिए you need to go for the surgery. Okay, now this is the test to test medial malleoli injury. Sorry, medial menisci. There also I have said medial malleoli. No, medial menisci and ACL injuries are always managed operatively. This is your test to elucidate medial meniscus injury. Name the test. No, Lachman test we have already discussed. This is your McMurray's test for medial menisci injury. Okay, McMurray's test. Medial menisci का क्या function होता है? Rotational stability. So यहाँ पे you can see rotate करके देख रहे हैं knee को. So this is your McMurray's test. And the next जिसपे supine करके and knee flexed करके you tested. This is your Apley's grinding test. This is your Apley's grinding test, again for medial meniscus injury. This is for medial meniscus injury. Okay, remember this. Now what is this? This is a splint which is used for foot drop, which is due to sciatic nerve injury or the common peroneal nerve injury. Okay, remember this. Just see the images, take a screenshot or save these images somewhere and just revise such 15 to 20 images in a day. It will hardly take you 5 minutes just to go through these images and you will never forget this. Okay, so you need to remember them, and this is the best way to remember. Okay, now this crescent sign is characteristic feature of which disease or which lesion of the bone? This crescent sign is characteristic of which lesion of which disease of the bone? Okay, this is characteristic feature of avascular necrosis. Okay, avascular necrosis का characteristic feature होता है Okay, the crescent sign, where you can have the crescent sign. Mein what you have the subchondral cysts. Later on, there will be collapse of the femur head, and then you will have the secondary osteoarthritis. And treatment of choice is always surgical, and that is arthroplasty. In case of hip, you will go for the total hip replacement. Okay, now there are three most common bones that are affected with avascular necrosis. The most common bone is your hip mein femur head. Second most common is your scaphoid, and third most common is your talus. Okay, remember, ye bones, they readily go for into osteonecrosis. It is also called as osteonecrosis. Avascular necrosis का ही दूसरा नाम है. Now scaphoid जो होता है, उसमें you need to learn the location also. So scaphoid के three parts होते हैं. Proximal 1/3, middle 1/3, distal 1/3. Proximal 1/3 is called as the pole. Distal 1/3 is called as the tubercle, and the middle 1/3, or to be more specific, the junction between middle 1/3 and the proximal 1/3 is called as the waist. So most common site of fracture is your waist, and most common site of AVN is your proximal 1/3 or the pole. So if there is fracture of the waist also, then the necrosis or the avascular necrosis will be of the pole only. Okay, so remember this about the scaphoid. Now for the femur head, you have classification. Mainly you just need to remember the name, that is the Fickett classification or the Fickett-Arlett classification. And here in stage 3 you will see the crescent sign on the X-ray, and in stage 4 you will have the arthritis or the secondary arthritis or the secondary osteoarthritis. Okay, बस इतना ही याद रखना है. And also newer classification called as Steenberg classification. इसके अलावा कुछ नहीं याद रखना, बस just remember Steenberg classification is also used for femur head avascular necrosis. Now this is a traction used for the cervical injury. Okay, now name this traction. Okay, name this traction. This is called as head halter traction. Okay, this is called as the head halter traction for the cervical injury. Bas itna hi yaad rakhna hai. Now what is this? This fracture is used for generally for fracture humerus, that to the condylar area mein, or the distal humerus fracture was used. Nowadays these are not used, but still photo is important. Okay, and identification is important for examination point of view. So name this traction. So this is Dunlop traction. It is called as Dunlop's traction. Okay, where it is used for the supracondylar and the transcondylar fracture in children of the humerus. Okay, now we'll study about the vertebral column से related or the spine से related सारे images. We'll do a rapid revision of the entire spine injuries as well as the entire orthopedics of the spine, and it is important for the examinations. Okay, spine से एक question आता ही आता है. Okay, sorry. So this is your normal anatomy of a spine, where you have this vertebral body. This is your anterior part. This is your posterior part. Okay, so thing that you feel at your back, that is your posterior part, and that the thing that you feel is your spinous process here. Okay, and दो vertebral bodies के बीच में you have the intervertebral disc. okay, intervertebral disc. And this intervertebral disc is also made up of two parts. The outer fibrous tissue, tough tissue, is called as the annulus fibrosus, and in the middle there is a jelly like substance which is called as the nucleus pulposus. Now the disc prolapse is a degenerating disease, and it starts from this annulus fibrosis. There is weakening of the annulus fibrosis, and the nucleus pulposus will come out from that weakened place, and there will be herniation or prolapse of the disc. Okay, so cervical, you have 7 vertebra. Thorax, you have thoracic is also called as the dorsal spine. You have the 12 vertebra, and lumbar mein you have the 5 vertebra. Vertebral body, this is your transverse process, this is your spinous process. Okay, and between transverse process and the spinous process you have the, this part is called as your lamina, and between body and transverse process this part is called as your pedicle. Okay, so if there is nerve compression in case of vertebral fractures or PIVD, prolapse, etc., then to decompress the nerve roots, you, what you do, you do the laminectomy. Whereas in case of fracture spine, you need to stabilize the spine. Okay, then you put the screws, so it is put in the pedicle part, so that's why they are called as the pedicle screws. I'll show you the photographs and the x-ray images in the coming slides. So remember कि pedicle and lamina की क्या क्या importance है. Okay, so anteriorly, posteriorly, body होगा, pedicle होगा, lamina, and the transverse process, spinous process, vertebral foramina containing the spinal cord proper, and the facets for the vertebral adjacent vertebra and the ribs. Okay, now very important thing is your vertebral arch. So remember, जो भी चीज posteriorly है from the vertebral body, it will form the vertebral arch. So the transverse process, the spinous process, the lamina and the pedicle, these all form the vertebral arch, not just the lamina and the pedicle. Okay, remember this, this is important. Now ligaments, very very important, and you have this one orange part, it is your anterior longitudinal ligament in front of the body, that is anteriorly. Just behind the body and the disc, you have the posterior longitudinal ligament in front of the vertebral arch. Now in vertebral arch, you have 3 types of ligaments. First, this one, this is your ligamentum flavum. This is your interspinous ligament, and this is your supraspinous ligament. Okay, very very important hai ye. Okay, now on the basis of these ligaments, the vertebral column is divided into 3 columns. That is called as the anterior column, middle column, and the posterior column. And learn this image. In anterior column, anterior longitudinal ligament and anterior 2/3 of the vertebral body and disc will be there. In middle column, posterior longitudinal ligament and 1/3. So remember, posterior longitudinal ligament is not the part of the posterior column. Very frequently asked question. Posterior longitudinal ligament is not the part of the posterior column. It is part of the middle column. Now posterior column mein you will have the vertebral arch and the interspinous, supraspinous, transverse process, spinous process, lamina, pedicle. All these will be in the posterior column, not the posterior longitudinal ligament. Very important, remember this hamesha. Okay, disc bulge and herniation, we'll see. Now this is the stages of the disc herniation. This is the normal. यहाँ पे degeneration is starting. So in the first stage, what will happen? The annulus fibrosis will get weak. So there will be bulging of the disc or the prolapse of the disc, but still the annulus fibrosis will not get broken, and the nucleus pulposus will not lose its contact with the parent disc. But if the annulus fibrosus is broken, then the nucleus pulposus will be poured out, but still in front of the posterior longitudinal ligament, not piercing it, and it still have contact with the parent disc. This is called as your extrusion. Okay. Now in sequestration, ये तो हो गया prolapse, this is extrusion. Now in sequestration, the nucleus pulposus will pierce the posterior longitudinal ligament and it will lose its contact with the parent disc. So this is called as your sequestration. Okay, and obviously ये सब bulge होके extrude होके sequester होके कहाँ पे posteriorly they will compress the spinal cord or the nerve roots. Okay, that will lead to the classical pain, that is the sciatic like pain, or in advanced cases you can also have the motor loss or the bowel bladder incontinence, etc. Okay, level of disc versus number of nerve root, ये समझना. Okay, very important. Okay, so इसके लिए क्या होता है कि if I have disc prolapse at L4 L5 level, then nerve compression will be at L4 only, L5 only, L4 plus L5 both. Okay, in तीनों में से what will be the answer? Okay, I'm giving you 15 seconds. Let's create a poll. Okay, 15 seconds का poll, and okay. So the correct answer is your L5. Okay, L5 why? Okay, let's understand कि L4 L5 के बीच में this is the disc. So यहाँ से nerve roots निकल जाते हैं, herniation यहाँ पे होता है. So always remember कि L4 L5 अगर है तो L4 nerve roots will not be compressed because the compression is below that entrance or the exit of those nerve roots. Okay, so L4 L5 पे अगर there is some disc problem, then the compression will be at the lower vertebra. हमेशा याद रख लो lower vertebra का ही compression होगा. So the nerve roots that will be compressed will be L5. Okay, remember this, very important. Now here you can see in the MRI. Okay, this is your vertebral body. Here this is your vertebral disc. यहाँ पे that green outline is your anterior longitudinal ligament. Here this black outline is your posterior longitudinal ligament. बीच में you have this spinal cord, this whitish area, and here you will have the vertebral arch and all the ligaments. So here you have the spinous process. Okay, this is normal, and this is the intervertebral disc which is bulging and compressing the nerve roots, causing the cauda equina syndrome. Okay, so दो confusing चीजें होती है, that is the cauda equina syndrome and the conus medullaris, and इनके differentiation and all we'll discuss in the coming slides, so don't worry. Okay, I just want you to understand that what are the structures that can be seen in a normal MRI. And here now you can see this is your S1, so L5 L4 L3 L2 L1. Okay, this is your counting. Okay, now here are the different normal disc, degenerated disc, thinning disc, herniated, and the bulging disc. Okay, herniated means it has touched the posterior longitudinal ligament. आप ऐसे याद रख लो. Okay, so now the myotomes are very very important. Dermatomes, so it is the sensory or the skin supply of the nerve, but myotones ki suppose you have a spine injury and there is some weakness in lower limb. Now how will you identify कि what level पे spine injury है? Okay, so L4 L5 पे if there is prolapse, then how will you identify कि clinically without MRI कि at which level there is nerve root compression? So remember L5 के लिए you have this great toe extension. So if there is tingling sensation, numbness or weakness on great toe extension, then L5 nerve root is compressed. That means L4 L5 के बीच में there is some lesion or nerve compression. Okay, so it is very important. Please remember them, the myotomes. Don't confuse them with the dermatomes. C1 C2 C3 is for the cervical region, and उसमें भी flexion extension and lateral flexion. C4 C5 is for the shoulder, okay, shoulder elevation and the abduction. C6 C7 is for the elbow flexion and extension. C8 thumb, and T1 for the finger adduction. Now L1 L2 for the hip flexion, L3 for the knee extension, L4 L5 for the ankle का क्या dorsiflexion, and L5 में very important great toe extension for L5 alone, and S1 will be your ankle joint का plantar flexion, and rest will be the bladder or the rectum or the bowel bladder incontinence. Okay, so remember now this is a clinical picture of a typical clinical picture of a person having sciatica pain, or it is called as the sciatica pain, where there will be weakness in a unilateral pelvis and there will be tingling and pain at the posterior side of the thigh radiating to the knee and the leg also. So there will be a compensatory scoliosis. What? There will be a compensatory scoliosis or a pelvic tilt and a pelvic tilt to compensate this weakness, very easily appreciable in this image. Okay, वेरी इंपॉर्टेंट नाउ कौन सा नर्व रूट कंप्रेस है या फिर जो पेन हो रहा है बैक पेन, इट इज ड्यू टू some neurological pain or just a mechanical pain, that you can identify with this straight leg raising test, where in the supine position you ask the patient to raise the leg with knee in extension. Okay, so remember this pulse pain यानी 45 डिग्री पे ये पेन होता है, that is अगर if pain occurs in less than 90 degrees, basically ऐसे याद रख लो, in less than 90 degrees, then it is a neurogenic pain. Okay, it is due to a neurological problem, and more than 90 degree पे pain होता है, then they are the mechanical causes of back pain like muscle spasm, etc. Okay, just remember this pulse pain is important, and also for the diagnosis of the PIVD you have an important test which is called as the LASIK test. Okay, when 90 degree पे knee and hip you flex, okay, and then holding it like this you gently extend the pain, and if there is radiating pain in the leg, then this is positive, pointing towards PIVD. Okay, very important, remember this. Now एक और पहले यूज होता था, अब MRI आने के बाद generally it is not used, that is the root cutoff sign, where you inject a dye, radiopaque dye, and you do the serial X-rays, and if there is compression or there is cutoff in the nerve root or spinal cord, you can see it very easily. Okay, this we have already discussed this diagram. Okay, so here you can see this, there is normally only a disc bulge, and here there is herniation which is impinging the spinal cord or compressing the nerve roots. Okay, now we'll differentiate between कि कॉर्नस मेडुलैरिस सिंड्रोम, कॉर्डा इक्विना सिंड्रोम क्या है, एंड देन वी हैव, उसके लिए फर्स्ट वी नीड टू नो कि व्हाट इज कॉर्नस मेडुलैरिस एंड व्हाट इज कॉर्डा इक्विना. Okay, so let's take a 10-second break. Okay, just for 10 seconds. Okay, so the last part of the spinal cord which forms a V like this, and iske baad the spinal cord is only in the form of a thread, but still it is covered with the dura mater and the arachnoid and the pia mater. So this last part is called as the conus medullaris, and it is generally at the level of L1 or L2. उसके बाद the spinal cord is only in form of a thread, and यहाँ पे भी at S1 S2 जो ड्यूरा मैटर एरेक्नॉइड पाया मैटर की कवरिंग होती है, it is not there, and now after S1 S2 it is called as the phylum terminal, where only pia matter is there. Okay, so phylum, so ये पूरा ही phylum terminal होता है. This is your phylum terminal internum, this is your phylum terminal externum. Okay, very easy. Subarachnoid space CSF, that's why L1 L2 के बाद में ही you do the lumbar puncture or you give the spinal anesthesia, because there will be very less chances of irritating the spinal cord or the very important nerve roots, because it will be only in form of a thread called as the phylum terminal. Now what happens is that कि इसके नीचे below L2 level, if there is compression of this intervertebral disc, then there will be, in case of intense बहुत ज़्यादा herniation हो गया, then there will be cauda equina syndrome, where यहाँ से जो ऐसे nerve roots निकलते हैं ना, see like this, okay, like this, these nerve roots यहाँ पे last में ऐसे निकलते हैं, these are called as the cauda equina, just like the horse tail. Okay, so conus medullaris में the compression will be L1 L2, and below this L2 to sacrum it will be cauda equina syndrome. Okay, so here L1 पे the sacral cord segments, lumbosacral cord not important, the important is this. Conus medullaris is always bad or have a worse prognosis, और symptoms वगैरह सब बहुत ज़्यादा होंगे as compared to cauda equina syndrome. बस ये याद रखना है आपको. Okay, except one thing, that is your this radicular or the neuropathic pain. Presentation: conus medullaris will be sudden with bilateral severe back pain. Sudden bilateral है, so the motor strength or the motor loss will be symmetrical. Okay, it will be symmetrical, and the ankle jerks will be affected. Okay, and early bowel bladder injury or the incontinence and impotency is also frequent. Whereas in cauda equina syndrome, बाकी सारे symptoms will be gentle as compared to conus medullaris, except one, that is the radicular pain or the sciatica like of pain or the neuropathic pain, neurological pain will be more severe in case of cauda equina syndrome, whereas it is unilateral and it is gradual in progression. Okay, so but and there will be asymmetrical loss of reflexes. Okay, and here both knee as well as ankle jerks will be affected, bowel bladder affected late, and impotency के chances are also less as compared to the conus medullaris syndrome. Okay, very important, just remember this, बहुत easy है, just revise it. ऐसी टेबल कहीं पे भी सेव कर लो. 15-20 days में just 2 minutes के लिए if you just read the table, you will never forget it. Okay, तो ऐसी छोटी छोटी चीजें you need to do for scoring well and to to build up your memory. Okay, about the things, very important है ऐसी चीजें. Now what is this? This is your internal gibbous, and in which disease of the spine it is seen. Very characteristic feature of this disease. Okay, which disease of spine it is seen? This is seen in case of port spine, that is TB of the vertebral column, internal gibbous, where you can see that the prominent vertebral border. अब ये बहुत important काम की चीज है. As a rule of law, everywhere you can use it. In case of TB of spine, that is port spine, everything will be affected सबसे पहले in the anterior direction of the spinal column or the vertebral column anterior. Whereas in case of PIBD or any disc disease, or even in case of vertebral injuries due to trauma, etc., anywhere else, the affected area of the vertebral column will be your posterior. Okay, as a rule of law you remember this. So kahin pe bhi agar TB spine or port spine, if there is the mention of this, then anteriorly you have to go for the answer. Remember this. Okay, so yahan pe bhi the angulation is anterior angulation, not posterior angulation. Just remember this. So this is your internal gibbous seen in case of port spine. Okay, remember it, very important and very easy, that we have discussed. Now if you will see here, the rib wala part, there is the facets. Okay, that it is not important, that's why I'm not going, and anatomy you will cover this. Okay, now very important two things. Okay, very ध्यान से see these two things and name these two things, what is one and what is two. Okay, here you can see very easily that this is your L5 and it has fused with the sacrum, and यहाँ पे 3D CT में 3 dimensional में you can very easily see. Okay, so this is called as your sacralization of the lumbar spine. Okay, this is sacralization of the lumbar spine, and in image 2 you can see that S1 is not fused with the rest of the sacrum. So this is called as your lumbarization of the sacral spine. Lumbarization of the sacral spine. Now you will see कि सर कैसे काउंट करेंगे. So remember, हमेशा जो काउंटिंग स्टार्ट होती है, it gets start from the C1. Okay, जो आपको सारे स्पाइन के 3D CT में सैच कट में you will see one सबसे ऊपर ही ऊपर वाले एक vertebra where you can see that odontoid process there. Okay, then you can identify ki that is C2. Okay, then from the C2 you will start the counting. Okay, then you will get your desired number of the vertebra. This is the best way to count the vertebrae, because earlier हमने एक दो जगह discuss किया and we were very easily counting from the sacrum, but because of this sacralization and lumbarization wala phenomena, you count the vertebra from the cervical region. Okay, very important. Just mark these images, very important, especially the lumbar lordosis. Okay, this is called as the lumbar lordosis and this is called as the cervical lordosis. Okay, these are the deformities. Okay, sway back deformity. This is your lumbar lordosis, excessive lumbar curvature. This is your kyphosis. Okay, this is your forward head, and what is this? This is the normal or the good posture. Okay, so now we'll come to vertebral injuries. Which fracture is this? Okay, which fracture is this? This is a compression fracture called as the wedge fracture. Okay, wedge fracture because there is only one wedging. Okay, देखो यहाँ पे there is only one wedging of here, and the entire posterior 1/3 of the vertebral body or the nerve roots behind them are all normal. Okay, so this is called as your wedge fracture, and it is the most common type in flexion injuries of the spine, and these flexion injuries are the most common type of spinal injuries. Okay, remember this. This is important. Now second type, here you can see ki anterior posterior entire vertebral body is fractured and they are displaced, so this is called as your burst fracture. Okay, this is called as your burst fracture. This is your burst fracture here, but still सर्जरी करनी है या नहीं करनी है, तो always remember the need for the surgery or the surgical indication in any type of spine fracture. It depends. For that we do a special grading which is called as the Tillix scoring or the Tillix grading, and we'll read about that in the coming slide. Okay, very important. इसमें 3 factors होते हैं, that is your TLC injury, that is posterior column injury on seen in the MRI, very important. The motor or the neurological function, and third is type of fracture. Okay, very important. We'll see about it. Now classification, as we have discussed, flexion, rotation, vertebral compression, extension, all these are common. Most common is your flexion injury, जिसमें wedge compression type का fracture होता है. And see, this is your flexion rotation injury. Okay, flexion rotation where you have this burst fracture. So compression fracture, wedge shaped fracture, whiplash injury, cervical spine. First of all, when there will be a sudden hit, the momentum will be less. So first of all, there will be flexion followed by the hyperextension. So hyperflexion, then hyperextension. This will be the type of injury or the nature. So what is this? This is your chance fracture. Now what is the difference between chance fracture and the burst fracture? In chance fracture, the vertebral arch or the entire spinous process जो होगा, it will, if it is also fractured, fracture line is passing through the spinous process, then this is called your chance fracture. Very important, remember this. ये तीनों में differentiation. Okay, so chance fracture, horizontal fracture, only posterior vertebral body तक. Burst fracture, wedge fracture, single column anterior vertebral fracture, and vertebra plana is that anteriorly and posteriorly they have lost most of the height and they will be like the plane. Here you can see this is called as your vertebra plana, also called as the pancake, silver dollar, or the coin edge vertebrae, or this is vertebra plana. Okay, remember this, very important. Now this is special traction again which is used for cervical injury. वहाँ पे we have talked about the head halter traction, but that was a skin type of traction. But here these are the Crutchfield tongs. Okay, photo yaad rakh lo, these are very important. And this photo we have seen the differences, the compression, the wedge, and the burst fracture. Okay, now fracture of the atlas vertebra. So इनको याद रखने का एक तरीका है, alphabetical order में if you will see कि P Q R S T U V W X. So atlas में T पहले आता है as compared to X. So that's why atlas is C1 and axis is C2. Okay, now atlas जो fracture होता है इसमें you have a C1 fracture. If there is fracture of C1, just remember इसको बोलते हैं Jefferson fracture. Okay, and this is a typical fracture where there will be fracture like this. Okay, the transverse process जो होगा दोनों में होगा. Okay, so the anterior and the posterior arches of the atlas are fractured. So Jefferson fracture, C1 fracture is called as the Jefferson fracture. Name से आता है, important है. Okay, now this is a splint used for the cervical injury. Okay, so ये brace है तो इसको क्या बोलेंगे? See, cervical thoraco lumbar, so CTLO. Okay, thoracolumbar, sorry, cervicothoracolumbar orthosis है ना. ऐसे TLSO brace, that is thoracolumbar sacral orthosis. Okay, so this is CTLO brace. These are the hello pelvic traction system. पहले use होते थे, but images are important, so this is called as your hello pelvic traction system. Okay, now important fracture D1, that is your thoracic spine first fracture, and that too only the spinous process. Okay, very important, remember that too only the spinous process is called as the clay Chevrolet fracture. Okay, D1 ka and spinous process called as the clay Chevrolet fracture. Okay, so नाम से पता चल रहा है in shoveling by the laborers. Okay, laborers में muscular action एकदम intense muscle spasm की वजह से laborers में common है D1 spinous process clay shovelers fracture. Okay, this is the image. That I was talking you about it. What is this? This is your pedicle screw fixation. This is your pedicle screw fixation. This is your pedicle screw fixation, and in there will be nerve compression and vertebral injury. तो posteriorly होगा. So what for decompression you will do the laminectomy, which is not seen in the X-ray, and laminectomy will serve the purpose of decompression of the compressed nerve roots. Okay, so here you will do the laminectomy if there is any neurological imbalance. Okay, so laminotomy and laminectomy में difference होगा. Laminotomy में only the ligamentum flavum को you will cut, whereas in laminectomy ligamentum flavum के साथ में the entire pars intercularis etc. You will just remove the entire lamina. So this will be laminectomy. So Dennis classification 3 column we have seen. Tillich's classification for the indication of the surgery or the operative indication 3 factors पे depend होता है. We have already discussed, that is the morphology of the fracture, the PCL, that is the posterior column integrity. For this you need the MRI, and the neurological status. Okay, so depending on the scoring 5 या 5 से ज़्यादा है, then it is always surgical, but if it is 4 it is the surgeon's choice. Okay, इतना deep में नहीं जाना, just remember Tillich scoring, and we have already discussed कि अगर 4 से कम है conservative and 4 से ज़्यादा है the surgery. Pedicle screw fixation with laminectomy if there is any motor weakness or neurological signs. Okay, now we'll come to the kyphosis and scoliosis. So this is scoliosis. Okay, this is scoliosis. तो scoliosis किसी भी एक typical scoliosis patient में what will be the clinical signs that you can see? Okay, so first of all, head will not be in the center of the body, and one shoulder girdle will be above as compared to the other, and more prominent. Okay, and like there will be gap between the arm and the trunk, unilateral. Okay, curvature of the spine, and obviously to balance it there will be pelvic tilt, so one hip will be more prominent. Okay, just remember this, and it is very important. So here you can see there are different types of scoliosis. Okay, so आगे चलने से पहले let me tell you about the types of scoliosis. First of all, they are of 2 types. First is structural scoliosis, and structural scoliosis जो होता है obviously नाम से पता चल रहा है there will be some structural defect या deformity in the vertebral bodies or the vertebra. So the most common type or overall most common is your idiopathic, which is most can be seen in any age group, but most commonly seen in case of adolescent. this is your idiopathic. Okay, and second most common या second जो part है most common in structural, it is your congenital scoliosis, and here there will be deformities in case of vertebral column. Okay, so the spine will be deformed, the vertebra will be deformed, and there are different types of vertebra ki fusion hai, segmentation defect hai, kya hai, which we'll study in the coming slides. Okay, so structural. Now non structural jo hota hai, it is can be compensatory, like if there is any disease of the pelvic system or PIVD, etc. So it can be compensatory, it can be postural also, and most common is your postural one. So that's why, and kyphosis and scoliosis, they are increasing in adult population, especially after 30 years of the age, and elderly population also, because nowadays we are not doing so बहुत ज़्यादा work. Okay, we are not taking care of a posture, so that's why there are high chances of kyphosis and scoliosis. And kyphosis पहले होगा if there will be any structural deformity. Okay, so remember कि हमेशा sit with your back and your thigh at the 90-degree angle at the hip, with your spine straight like this, ऐसे नहीं. Okay, ऐसे नहीं, with your spine straight like this, and this these small things you should keep in mind. Okay, now in case of congenital scoliosis that we are studying. Okay, so in case of congenital scoliosis, there can be different types of deformities. Okay, so what can be those deformities? First of all, there can be wedge vertebra. So wedge vertebra क्या होगा? There are two segments of the vertebral column which fuse to form a single vertebra. Okay, so in wedge vertebrae, both column will be होंगे, left and right ऐसे याद कर लो, but one will grow more, so there will be unilateral formation, partial unilateral failure of formation. So this is your wedge vertebra. Whereas in hemivertebra, only and only one side of the column will be there, so there will be complete failure of formation, but unilateral. This is your hemivertebra. Now sometimes during fusion only one half जो होगा segmentation में only there is unilateral failure of segmentation, so this will be called as your congenital bar type of vertebra. Okay, or also called as the unsegmented bar. Whereas अगर दोनों साइड का होगा, so there will be a complete single vertebra which is called as the block vertebra. Okay, name बहुत important है, images भी बहुत important है, and most commonly you remember कि most common type of deformity of vertebra in case of congenital scoliosis is your mixed pattern. कोई भी single एक आपको individually nahi milegi, mostly it will be mixed pattern. Okay, this is called your mixed type. So here also you can see कि there is this hemivertebra and fusion, complete fusion, that is the block vertebra. Okay, so failure of formation mein you can have the wedge or the hemivertebra, and in segmentation you can have the unsegmented bar or the block vertebra, and this is your mixed where you have the unsegmented bar with single hemivertebra. Okay, so very important. Now एक और important classification of the scoliosis is on the basis कि कहाँ पे there is angulature or the curvature. Okay, this is also very important, ये भी याद रखना है. So thoracic, thoracolumbar, lumbar, combined thoracolumbar. So most common is a thoracolumbar, and worst prognosis जो होता है it is of the thoracic. Okay, worst prognosis जो होता है, worst prognosis of scoliosis, it is in the thoracic vertebra, and in thoracic vertebra curvature के बाद you will get a rib hump. Okay, special feature of thoracic vertebra, rib hump. Picture I have added in the coming slide. Okay, next slide here. Okay, this is your rib hump, characteristically seen in case of thoracic scoliosis, characteristically seen in case of thoracic scoliosis. Okay, remember this. Okay, now uh, very important is its treatment. Okay, so remember कि treatment जो होता है it depends on variety of things. So most important चीज पे जिस पे treatment depend होता है is whether the scoliosis is progressive or not progressive, and if it is progressive, then you have to go for the surgery because the curvature जो होगा वो और ज़्यादा बढ़ता जाएगा. Okay, so progressive है कि नहीं है, so obviously if the skeletal growth is remaining, then obviously जैसे जैसे there will be skeletal growth, then the scoliosis or the curvature will be progressive. Now to judge that skeletal growth, we have a special index or sign which is called as the research sign, and see this is based on the iliac apophysis. Okay, and how you will see, you can see this black line here, this black line just above my cursor in yellow. So agar ye black line puri hai, that means your research score is 5. Okay, and if your research score is 5, that means 5 research score पे growth अभी बाकी है. Okay, so there will be growth, so there will be progression, and like this here the research score is 1.5 or max to max 2, yani growth is there but growth abhi hogi, there will be more growth but less as compared to this. Okay, so very importantly research score is very important, and you identify it like this. Now next is this Cobb's angle, which is very important, as it is one liner question was there in the NEET PG 2020. This साल I had given the exam, in my paper the Cobb's angle was there. So first and the last vertebra of the main curvature, क्या होता है main curvature, and उसको support करने के लिए there are the secondary curvature. So main curvature के first and the last vertebrae, which are called as the end vertebrae, उनके बीच में if there is an angle, this is called as the Cobb's angle, and उसके ऊपर वाला it is your neutral vertebrae. Okay, so एक तो ये चीज you need to remember very अच्छे से. Now secondly what you need to remember is operative indication according to the Cobb's angle. So remember it basically operative indication सिर्फ Cobb's angle, not it depends not only on singly on the Cobb's angle, it depends on कि age क्या है, progression है या नहीं है. So but single liner की बात अब if we consider more than 30 degrees Cobb's angle in a 15 to 20 year यानी late adolescent में, then it is your operative indication. Okay, remember this very important. This is your Cobb's angle, we already discussed it. So this is your lumbar scoliosis. Okay, here you can see this is your lumbar scoliosis. Now non-operative methods of the scoliosis में, first of all this is your Milwaukee brace, very important. सबकी images you need to remember, एक ना एक image आती रहती है कभी ना कभी किसी एग्जाम में. This is your Milwaukee scoliosis or kyphosis brace, it is used in both, remember. Okay, and इससे सुंदर दिखने में more cosmetically good is your Boston brace, that is cosmetically superior as compared to the Milwaukee brace. Okay, this is your Boston brace. Okay, here earlier they used to be used, this is your turnbuckle brace where you have this buckle, and here you can tighten it, utta correction ho gaya, then you can again tighten it to at another level. Okay, this is your turnbuckle brace, and here you have the plaster cast, which is called as the localizer cast, which was used earlier, nowadays it is not used. Now operative indications में remember, very important, remember कि operative indications में which surgery you do for the scoliosis, you do the fusion of the vertebral column. Okay, you fuse the vertebrae. Okay, you do the fusion. Okay, now this is your collateral traction, which was previously used pre-operatively. Okay, but nowadays these pre-operative tractions are not used, so it is a pre-operative traction called as the collateral traction. And now post-operative different types of rods are used. Okay, so these are the Harrington distraction syndrome, Duer's compression assembly, and the Luke Herschel system. Okay, now we'll come to the kyphosis. Scoliosis is the curvature S shape, whereas kyphosis is the forward bending. Okay, forward bending. So this is your kyphosis. Okay, this is your kyphosis. You can appreciate very easily here. Okay, so this is your kyphosis. Here you can see in the lower thorax and the upper lumbar vertebra, this bending or the rounding off, this is a typical kyphosis. Okay, now ये चीज बहुत बहुत important है kyphosis में. If only one vertebrae is affected, this is called as your knuckle or the knuckle gibbous. 2 to 3 angular gibbous, and more than 3 the round kyphosis. So this is your round kyphosis. Okay, this is your round kyphosis. This is your round kyphosis. Okay, and only one single prominent जो होती है, it is your knuckle. Okay, here you can see this is your knuckle, whereas spot spine में जो अपन ने देखा था, that was your internal gibbous. It is generally an angular gibbous. Okay, internal gibbous is generally an angular gibbous. First knuckle gibbous, only one vertebrae, and more than 3 is your round kyphosis. Okay, it is your round kyphosis. Now there is a specific disease which is called as the Schurman's disease of the thoracic spine, where there is kyphotic deformity or the rounded appearance. But remember, normal kyphosis में there will not be pain, या rest में pain तो नहीं होगा, but there is severe pain here. So this will differentiate it. So if there is intense pain, especially at the apex of the curvature, then this is your Schurman disease. बस इतना सा ही याद रखना है. Okay, now what is this? Just ये दिया है, ये बहुत 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 important चीज है. Name the disease. Which disease is this? Very very important. This is your ankylosis spondylitis. Okay, here you can see the fused bamboo spine or the dagger sign. Okay, this is your bamboo spine, and most common deformity or the early late complication of ankylosing spondylitis in the spine is your kyphotic deformity. Okay, the most common is your kyphotic deformity. Okay, very very important. This is your kyphosis in bamboo spine. Okay, so this ankylosing spondylitis is very important. This year in NEET PG 2021, you have 3 questions from this topic alone, and 2 were from the ortho only. Okay, so I always tell you कि ankylosing spondylitis आते ही you need to click 2 things in your head. First, it is HLA B27 positive, and second, bamboo spine. Okay, most common age group is 20 to 30-year-old male. Okay, most common presentation is your stiffness with lower back ache. and the pain have a characteristic feature, that is the pain increases while resting. So you will have a typical complaint ki decreased sleep or early morning severe intense pain, or the sleep cycle will be disturbed, whereas the pain will decrease on work. Okay, on work or walking etc., the pain will decrease. Okay, now ankylosis yani the joint will be fused, so there will be fibrous to in the starting, then there will be bony ankylosis. Most common or the first thing to be affected is your sacroiliac joint. Okay, it is your sacroiliac joint, remember, then the other things are affected. And a important Ganslin's test is used for the sacroiliac, sacroiliitis बोलेंगे उसको, कौन सा sacroiliitis. And another important thing, that it start as enthesitis. Now what is enthesitis means, what is enthesis? Enthesis is that part where that part of the bone where any tendon or the ligament that is attached to that bone is attached. So इतना सा जो part होता है, if there is this vertebral body and here there is attachment of this muscle or tendon or ligament, so this part here, this will be your enthesis and the inflammation will be enthesitis. So the ankylosing spondylitis will start as enthesitis. Okay, remember. Now एक और important चीज आ is systemic manifestations. इसके साथ में you can have the reactive arthritis of knee, ankle, elbow etc. So इस साल में there was a feature given bilateral heel pain. There can be reactive urethritis, there can be reactive uveitis, and also remember one more thing, in systemic it has a high correlation with the ulcerative colitis. Okay, किसके साथ? ulcerative colitis के साथ. Okay, this is very important again. Now we'll come to the TB of bones. Okay, tuberculosis of bones, it can be due to hematogenous spread और पास के किसी joint या bony lesion या soft tissue lesion से आ जाता है. Most common is a hematogenous route. Remember this. Okay, now spine में it is called as the pot spine, already discussed. In long bone called as the TB osteomyelitis, and most commonly affected bone is your tibia. Okay, in short bones most commonly affected are the phalanges, and it is called as the ductilitis ventosa. Okay, here you can see this is your ductilitis ventosa. Okay, what is this? This is your ductilitis ventosa, very important. Okay, now what is this? This is your wandering acetabulum. This is your wandering acetabulum. And यहाँ पे what you have done, you have sorry, this is not the wandering acetabulum. This is a surgery used in case of chronic TB of hip joint. Okay, where earlier it was used, but nowadays infection को control करके you go for the THR. Okay, so this is where the head of the femur is removed and उसके अलावा कुछ नहीं किया है. Okay, this is called as the girdle stone surgery, where obviously functions तो नहीं आएंगे, movements नहीं आएंगे, but it will reduce the pain. So basic aim या basic complaint जो patient की होती है, that is your pain. Okay, so this will reduce the pain. So this is a typical X-ray of the girdle stone surgery, where you just simply remove the neck and the head of the femur. Okay, now wandering acetabulum is this. Here there will be a typical sign called as the wandering acetabulum in case of TB of hip. So remember, most common site of tuberculosis of bone is your spine, second is your hip, third is your knee. Okay, and there is your Atlantic gate in case of TB hip. Okay, this is this gate where there is pelvic tilt and compensatory scoliosis, etc., to make up for this defect. Okay, now stages of hip joint stages of TB of hip are very important. So remember, जो stage 1 होती है, it is called as the stage of synovitis. उससे पहले रिमेंबर वन थिंग, अगर आपसे कोई भी पूछे, इफ इन एनी क्वेश्चन इट इज आस्क्ड कि व्हाट इज द एटीट्यूड इन केस ऑफ टीबी ऑफ हिप, so remember it will be flexion, adduction and internal rotation, whereas there will be true shortening. Okay, there will be true shortening. What happens is that if there is a lesion, head is collapsed, osteoarthritis हो गया है, head is collapsed etc., तो obviously bone defect होगा. So both limbs को compare करोगे तो there will be true shortening. But in early stages of the disease, when bone अभी collapse नहीं हुई है, but still there is some lesion, so to compensate the deformity there is tilt in the pelvis. So एक तरफ का hip जो होगा, that will be apparently long and there will be apparent shortening. Okay, so in stage 1, that is stage of synovitis. In stage of synovitis, नाम से पता चल रहा है, synovium will be affected. There will be flexion but abduction and external rotation. Limb will be in the external rotation. Okay, limb will be in the external rotation. So remember, कोई भी adduction deformity होगी, so obviously in case of adduction deformity there will be apparent shortening because apparent length will be less. In case of abduction there will be apparent lengthening, and if there is no adduction, so यहाँ पे क्या होगा, there is abduction deformity, so there will be apparent lengthening. There will be apparent lengthening. Okay, whereas that is in stage 2, which is called as the stage of arthritis, that is secondary arthritis will start. So यहाँ पे the attitude will be properly of the TB hip, that is flexion, adduction and the internal rotation, but there will be adduction and there will be not true shortening, there will be only apparent shortening. Whereas in stage 3, which is called as the stage of erosion, there will be flexion, adduction, internal rotation, जहाँ पे acetabulum erode हो जाएगा, the head will be collapsed etc., and there will be true shortening. So remember all the 3 stages, and किसमें apparent lengthening है, shortening है, true shortening है. You need to remember this, very easy. Okay, now most common site where TB hip जो होता है, most commonly, and the first is the acetabulum, that to the roof of the acetabulum, then the epiphysis, femur head, the metaphyseal region, and the least common is your GT, that is greater trochanter. Okay, now in case of TB of knee, remember you will have a typical presentation which is called as your triple subluxation. It is called as your triple subluxation. You will have a typical feature, triple subluxation, where क्या होगा, the tibia will be flexed backwards and externally rotated. ऐसे समझ नहीं आएगा, अब ऐसे देख लो. Here you can see tibia backwards है, slide externally rotated hai. Okay, so there will be obviously arthritis, reduced joint space, and there will be ankylosis, bony ankylosis. Remember, हाँ, एक और important चीज, in case of TB, TB of hip, TB of spine and TB of knee. TB of spine में you will have the bony ankylosis, whereas in hip and knee both you will have the fibrous ankylosis, but obviously in the very late stages you will have the bony ankylosis. But अगर question आ जाए, you need to remember this thing, very important. Okay, so this is your triple subluxation, external rotation, posterior and the flexion. Okay, यहाँ पे you can see there is flexion, posterior and the external rotation. This is called your triple subluxation or triple dislocation of the knee. Okay, so flexion, posterior subluxation or the dislocation and the external rotation. Okay, this is your TB of the knee joint. Now we'll come to Sudek's dystrophy, okay, which is also called as the reflex sympathetic dystrophy, causalgia, complex regional pain syndrome, etc. And ये याद आते ही आपको ऐसी इमेज जो है, you need to remember कि yes, you need to remember this by this image. Okay, very important, remember this always. Wait, just give me a few seconds, I have an important message. Okay, so it is complex regional pain syndrome or reflex sympathetic dystrophy. So there is hands will be affected, so there will be pain, swelling, atrophy and skin changes, etc. बहुत सारी चीजें होगी. Okay, so there are different stages. So सबसे पहले complex regional pain syndrome, osteoic dystrophy, shoulder hand syndrome and causalgia भी बोलते हैं. So this is your stage 1. Okay, this is your stage 1 and यहाँ पे जो characteristic feature होगा, that will be your swelling. Okay, that will be your swelling. So यहाँ पे there will be swelling, pain, sensitivity to the pain will be increased. जरा से touch पे there will be very intense pain, constant pain. There will, the skin will be tender, warm and red. Okay, this is your stage 1 till 3 months. Then between 3 to 12 months you will have second stage called as the dystrophic stage, and isme sorry, the main feature of the stage 1 will not be swelling, it will be pain obviously. Okay, whereas in stage 2 the main feature will be your swelling, pain will be subside, cold ho jayega as compared to stage 1 the area. Okay, and there will be swelling here. Okay, and skin and nail changes will begin to come, and stage 3 will be your atrophic stage, where there will be atrophy, peeling, rough skin, etc. So this is a stage 3 called as the stage of the atrophy. Okay, now classification ये important है, याद रखना. CRPS complex regional pain syndrome type 1 and type 2. Type 1 में क्या होगा, there will be no nerve injury, frank nerve injury नहीं होगी. It will be due to prolonged immobilization or due to tight casting. You will have these symptoms of pain, tingling sensations and these all Sudek's dystrophy के changes. This is your type 1 CRPS called as the reflex sympathetic dystrophy. Whereas in type 2 you will have a frank nerve damage or nerve cut, which is called as type 2 of CRPS or the causalgia. Okay, this is called as causalgia. Okay, remember now radiograph X-ray में what you will see, X-ray में you will see three things. First of all, there will be osteopenia, but it will be periarticular osteopenia first. Secondly, you will have decreased joint space, and thirdly, you will have the periosteal reaction. Okay, so here you can see this is your one periarticular osteopenia, this is your two decreased joint space, and this is your three. Here you can see increased periosteal reaction or new bone formation. This is your typical X-ray of the Sudex dystrophy. And for diagnosing the Sudex dystrophy, you use a special bone scan, which is three-phasic bone scan you use for the diagnosis of Sudex dystrophy. Just remember this image and the term, that is, you use the bone scan here. Okay, so this was all about the images, and almost everything in the orthopedics we have covered in the images. Thank you wali slide, sorry upar reh gayi, so let me put that slide where it is. Okay, yes, thank you. Okay, so yes, काउंसलिंग का schedule आ गया था, but due to some court cases, by due to the reservation and also we will not go into that. It has been delayed or postponed till further notice. Okay, so don't get confused. जिनको INICT, in fact it is a blessing in disguise for the students who were like not satisfied with their marks, or who were like yes मेरा अच्छे नहीं आया, या who wanted to give INICT. So INICT पे focus you can do now. Okay, and for regarding that counseling thing, you have more time to inquire about the colleges and the branch, and uska do tarike I have already tell you. Go to that college or talk to a guy doing that thing in the college. And branch ka, if you have confusion, just go to any hospital, koi bhi hospital near your home or your MBBS wala hospital. Go to that there and work for few days in that concerned department, and you'll get the feel of that department. Okay, so but just don't waste your time, and don't get confused by the various counseling predictions. Okay, so it is very important, just remember ki yes, don't get carried away and focus on the counseling. But yes, predictions या फिर कोई भी news आए, just follow the news or accept the news which is on the net board or the MCI वाली counseling की website पर. Okay, so this was about this counseling wala gyan. Now for the INICT के लिए you don't need to panic. It is very easily crackable. Competition will be less. Just do the last 5 years papers of AIMS PGI. Obviously INICT के तो करोगे, INICT, AIMS, PGI, NIMHANS and JIPMER. Okay, and you will see that ki yes, questions के topics तो same ही हैं, but the question are different. So do those questions and not just question, read the explanations of that questions. या आपके पास नहीं है तो revise that topic from your notes, but do please read the explanations of those questions. वो बहुत important है, and you will see कि yes, बहुत सारे questions तो इसी में ही. Like when I had given my INICT in November 19, I was not prepared for the INICT, but at the time of giving my examination and after completing my AIMS, उस time INICT नहीं होता था, उस time AIMS था, different examination. So AIMS, the first thing that came in my mind was that I had only one regret at that time ki yes, yeah, it was crackable, I could have done that, but only thing is that if I had studied according to the INICT, sorry, the AIMS pattern, or I would have studied more conceptually. Okay, so बहुत important है. ऑल एग्जाम्स आजकल बहुत बहुत ज़्यादा कंसेप्चुअल पेपर आता है. So just remember, conceptual studies, INICT, last 5 years question, very, very important. Now, after 15 days, I had my JIPMER exam and I had given that exam. And for the JIPMER, I had done its last 5 years question and focused only on JIPMER. And I used to read at least 1 to 2 papers daily of previous year's JIPMER exam, and you'll not believe that I got AIR 700 in JIPMER examination just by doing the last 5 years paper, nothing else. Okay, so the in central institute के examinations के लिए the last 5 year pattern are very important. So you can contact a team anytime. You can contact any of our educators if you have any doubt regarding the subject or the counseling process or some ज्ञान वाली बातें चाहिए, you are feeling low or you want a motivational things, you can contact us anytime on the live chat of on our special class or the YouTube link. And if you like today's lecture, please watch my lectures on the special class and the YouTube. Please like, share, and subscribe. And you can subscribe on the Unacademy for any of a subscription course using this code, that is Anshul B10, to get extra 10% off. Okay, to get extra 10% off, and you can use it for the NEET UG, the IIT, the UPSC examinations, the CAT board examinations, everything, because Unacademy सब पढ़ाता है and ये code सब जगह चलता है. Okay, so just use my code, just study hard, focus on the concept, previous year's question. All the best. Good night. Bye bye. Take care.